everyone. Welcome to Homeopathy Study Group Pro Bono webinar. Good morning, good afternoon, and good evening. So nice to see many of you from different countries and different time zones. Before we start our webinar, always thank universe for giving us this great opportunity. And Dr. Sweta Singh, our Chief Administrator, will start the session.
Hi everyone, myself Dr. Shweta Singh, Chief Administrator, welcomes our respected speakers, Chairman and CEO Kavita Ma'am, volunteers and all the attendees to webinar. I would like to take the opportunity to introduce Homeopathy Study Group to all of you. Homeopathy Study Group Pro Bono was organized and founded by homeopath and humanitarian Kavita Kukunor, President and CEO of Kavita Holistic Approach, on May 5th, 2020. This study group is intended to be an offering from Kavita to the homeopaths around the globe. Sharing, goodwill, and solid clinical work within the classical model are foundational principles for the CA's mission and vision are very unique to inspire young homeopaths, mentor, provide excellency for educational purposes using holistic approaches via webinars, which are based on principles of classical homeopathy and provide professional continuing educational homeopathy credits for practitioners. We provide merit certificates for spreading the light of homeopathy around the globe. Dr. Kavita is a member of Kevin Friendly Foundation, a non-profit organization that helps to serve poor people in greater needs in India. She is nationally board certified by Council for Homeopathic Certification, CHC, and Agena CPD provider, and serves as the associate editor for the Homeopathic Heritage. She is a NASH mentor for North American Society of Homeopaths and life member of NCH, National Center for Homeopathy. She is the recipient of Martha Allman Community Service Award by National Center for Homeopathy and Best Entrepreneur Award from Dr. N. Linga Raju, Principal of JSPS Homeopathic Medical College, Hyderabad, India. TANA, Telugu Association of North America, a prestigious organization, honored and awarded her for selfless homeopathic and humanitarian services at Ladies' Night Out on October 2022, Michigan. Also, Dr. Kavita received the prestigious Legendary Homeopath Award with joint hands of Honorable Health Minister Dr. Dhan Singh Rawat, Senior MLA Mr. Harbhajan Singh Chima, Ex-Director Homeopathy Government Uttarakhand and Chairman of Homeocure and Research Institute during National Homeopathic Seminar Homeopathy the Future Medicine at Kashipur on 21st August 2022. We are proud to announce that Dr. Kavita was honored as Woman of the Year 2023 from prestigious organization NATA, North American Telugu Association, USA. Dr. Kavita was also honored by renowned DTA, Doctorate Telugu Association Executive Committee on Mother's Day at Michigan, USA with DTA Community Service Award 2023. She also received the Lifetime Achievement Award 2023 by Homeocure and Research Institute Director Dr. Rajneesh Kumar Sharma, Homeopathy Study Group, Kevin Friendly Foundation in presence of Chief Guest Dr. Shripad Hegde. Best wishes from Homeopathy 360. We are extremely happy and proud that we celebrated 14 years of her book, Beyond the Limits, A Challenge to Prove Oneself. And her second book, Dose of Spirituality with Kavita, has also completed 3 years on 22nd Jan 2025, which was launched in presence of Honorable Guest of Speakers, American Institute of Homeopathy, President Dr. Alex Baker, and Council for Homeopathy CHC President Dr. Sheetal Tiwari at our webinar. At CA's second annual celebration, our honorable guest of speaker, Dr. Jawahar Shah, Chairman of Enlightenment Education, launches audio version and hard copy. We have donated over $1,500 to 10 to 15 charities within 1 year, which we have also listed on the website. As of now, we have nearly 600 recordings on professional webinars related to homeopathy, health-related topics, and inspirational talks available on our channel, Kavita Kukunor. This webinar is moderated by CA family, myself, and Dr. Deepika Balani, CA volunteer. It is being recorded as we speak, and we will take questions at the end of the webinar. We will post jot form in Zoom webinar chat at the end of the webinar. Please fill the form to receive your certificate and kindly mute yourself and turn your video off for better connection. Now, I would like to invite Dr. Deepika Balani to read Code of Ethics.
Good evening, everyone. Thank you, ma'am and Kavita ma'am, for the opportunity to read the Code of Ethics. Ka Homeopathy Study Group Pro Bono Ethics and Benefits. To be a Ka speaker, need at least 1 to 2 months of active volunteering. Only Ka speakers' themes are promoted in the newsletters and webinars. Ka provides volunteering for 2 to 12 months, respects and inspires volunteers to grow. Active volunteers will be promoted through our website, social media, and added to our WhatsApp group. Articles of volunteers will be posted on CAR website and newsletter will be sent for publication at other journals too. Volunteers and speakers are eligible for prestigious CAR annual awards. Volunteers are also eligible for CAR inspirational talks. Volunteers are eligible for case discussions. CAR promotes homeopathic organizations as well as their mega events. CAR promotes great work of speakers through their book reviews. Honorable guests may propose their future courses of events after the webinar. CAR maintains a healthy and happy environment, so keeps only like minded folks. CAR requests everyone to maintain the confidentiality of the group. For more details, please visit our website www.kavitakehomeo.com. Thank you.
Thank you, Dr. Deepika. And now it's time to invite our speaker and introduce our honorable speaker to all of you. And today we have with us Dr. Samir Chaukkar. Professor Dr. Samir Chaukkar is teaching and practicing homeopathy in India and abroad since last 30 years and specializing in treatment of learning and behavioral problems of children including autism and ADHD. He is presently the Dean of Dr. Batra's Academy, Mumbai, which conducts postgraduate courses in dermatology, cosmetology, oncology, and allergies. He is also guest faculty at Medipol University, Turkey, Abrakan School of Postgraduate Courses, Brazil, Homeopathy College of Homeopathy, UK. He has presented his research papers all over the world, including US, UK, Australia, Dubai, Malaysia, Brazil, Turkey. He'll be speaking on the role of homeopathy in autism spectrum disorder. So, welcome, Dr. Samir Chaukkar, to CAR platform, and the stage is all yours.
Okay, can I share the screen now?
Yes, sir, please.
So, are you able to hear me, all of you? Is it
Yes,
clear?
sir. Yes.
Okay, so good evening, everybody. Good morning, good afternoon, good evening, depending upon which country you are in. And here it is a warm or a hot evening in India, in Mumbai. So, right in the beginning, there is some delay. So, I apologize for that because I was at my office and while coming back, there was a heavy traffic. So, there was some time lag. But then I'm very happy to be a part of KHA. I've been trying to talk at KHA for a long time, but because of my schedule or because of probably there are other speakers also, so many famous speakers at KHA that ultimately now I've got a time to share my experiences. So today we're going to talk on a very favorite topic of mine, of which I am kind of specializing in, and I am doing this since last probably 15 to 20 years. At that time, probably autism was not so much known, but when I started looking at these children and then reading more about autism, I could find out that these are children who are suffering from autism. So much so that there are groups of people who don't even feel that autism is a problem. I would like to give you an incident when I was decided to do a seminar in UK, and kind of my sponsor, she was advertising it. So there was a whole lobby of people who said that how can you do a seminar on autism when autism is not a problem at all? Our children are gifted. Okay, they are gifted, and there is nothing like treatment. Nobody can, of course, speak of cure, but there is nothing like treatment of autism, because how can you say treatment when our children are absolutely gifted? And at that time, I was thinking, why would they call these children gifted? Because they were not doing well scholastically, they were not able to speak, they were not able to maintain eye contact. Then why were they so special for these mothers and parents, right? But then as I started seeing more and more cases, I found out that there are some autistic children who are known as autistic savant children, who are absolutely intelligent, who are very, very clever, much cleverer, much intelligent than our normal intelligent, so-called normal intelligent people. And therefore, now I understand that why these mothers call their children gifted, and they are really gifted. So over the years that I have started seeing autism more and more, I have found that these children are really gifted, uh, except that they are living in a world of solitude. They are living in a world of their own. And that's why the name autism kind of matches them, because autism is within yourself. It is like autologous, inside yourself. अपनी ही दुनिया में रहना. That's what the mother usually says, that they are in their own world. Okay, so that is the most. So let us start with scope of homeopathy. Now this heading I used to do a lot many years back, and now I feel that should I say scope of homeopathy or efficacy of homeopathy? Because scope is there, 100% scope is there. We have been able to reverse so many children of mild to moderate autism to back to speech. They have started going to normal schools. They have started talking to their parents. Speech was a problem for them, but now they have started speaking, eating properly, behaving properly. No social withdrawal, understanding social cues. So homeopathy can do miracles, and that's what I've learned in so many years of my. Now it has been like 35 years of homeopathic practice in India and abroad, and 20 or 15 to 20 years in autism. And now I can say that they are really, really savant. They are really intelligent, and homeopathy can absolutely reverse them. Of course, in severe cases, we can palliate them. We can at least try to put them in normal schools, or we can at least make them stand on their own feet. By that, I don't mean they are physically handicapped, but mentally they can stand on their own feet. So recently, just yesterday, I saw a movie called Tanvi, which is a movie of an autistic girl, and she's an autistic adult, and she realizes the dream of her father to reach at Siachen Mountain. Now, these are the children who can do these feats. Remember, this is very, very important, right? So, scope of homeopathy in autism spectrum disorder. Are you able to see my screen, Shweta? My screen
Yes,
is
sir.
okay.
Yes, sir.
I'll just put it on a
Slide
slideshow.
mode. Yes, sir. Yes.
Okay. Can you see the next slide?
Yes.
Or is it the first slide only?
This is what is autism spectrum
Autism.
disorder.
Okay, fine. So let us start with autism. Let's start our journey. And one of my books, which is coming up and it is in publication now, is Autism Spectrum Disorder, A Journey Through Solitude. That means this is the journey that they are passing through. They are alone, remember. Even if parents are around, friends are around, everybody's around them, but still they are passing through a solitude. So it is a complex neurodevelopmental condition. Now, there are many neurodevelopmental conditions. This is part of a neurodevelopmental condition marked by persistent challenges in social communication. Now, the problem here is social communication. That's where you can differentiate it with ADHD. There are many times it is difficult to differentiate between an autism disorder and ADHD or attention deficit hyperactivity disorder. But the most important thing is ADHD people or ADHD children have no problems in communication, no problems in speech, no problems in, communication with each other. Here, there are problems with social communication, interaction. They have restricted interest. They will be attached to only few things like the wheels of a car, or they'll look at a fruit and they'll keep looking at it. You have seen the child in Tare Zameen Ke. That child was looking out of the window, looking at the butterfly when the teacher was teaching, lost in his own world. Remember, this is very, very important. So they have restricted interaction, restricted interest, repetitive behaviors. You see a lot of children doing flapping, you see children moving around, children dancing, children humming, children steaming. That is the word for autism. So there is a lot of repetitive behaviors affecting how a person learns, communicates, and interacts with the world. Now remember, they are all alone in the world. Even if they are surrounded by their relatives, parents, friends, they are still alone. So you need to understand an autistic kid. You can't get really irritated on them, right? Often children show symptoms of autism within the first year, and a number of children appear to develop normally in the first year. Now, this is important because the mother is going to tell you that mera bacha up to 1 year, 1.5 years, 2 years, he was okay. He was developing okay. He was talking. He started talking. He's talking, laughing. He started smiling. And suddenly something happened in the house. Maybe the father went out for his job. maybe the dog died, maybe the grandmother left home, maybe they changed the residence, and these are the things that can cause a term which is very, very important in autism is regression. If we try to get this regression and the cause of regression, any kind of autism is treatable. I may not say that it is curable, but any kind of autism is treatable and reversible if you find out the cause of regression. And this cause could be anything. Just we have to go back to our repertoire, in complete repertoire or in synthesis repertoire, go to the ailments from chapter in generalities, ailments from in mind, and try to find out what is that. It could be a loss, it could be loss of near and dear one, it could be jealousy. Now, I want to bring across a very, very interesting rubric, jealousy in newborn or jealousy in children when newborn gets all the attention. And we have got only two remedies, hyoscyamus and we have got ignatia. Now, both hyoscyamus and ignatia are quite different, but I have given many children I have given hyoscyamus and many children I have given ignatia, because ignatia is a moral child, remember. He is not going to harm the other child, but hyoscyamus will harm the child. That is the basic difference between hyoscyamus and ignatia. Both are jealous. Now, when we are taught ignatia, we are not taught that they are jealous, but they can be jealous, but morally they will not harm the child. They will not kick the child. They will not pinch the child, while a hyoscyamus child will do that. So find out this period of regression between 18 and 24 months when they start developing autism symptom. Ask the mother, ask the father, ask the teacher, because parent-teacher meeting is very, very important. After mother, I feel the second, or rather before mother, I feel it is the teacher where the child is spending most number of hours, and the teacher can give us the right data. Remember, while there is no cure for autism spectrum disorder, intensive early, now this is very, very important, early treatment can make a difference. Hence, we need to talk about autism within our circles. We need to talk about autism within our patients. If they have somebody who has got an autistic kid, they can always refer. Catch them early. Very, very important. This is one lesson that I want everybody to carry home. So what are the core characteristics? You look at this child. The mother is talking to him, but is he looking at her? No. So there are social communication challenges, difficulty with back and forth conversation, understanding social cues. Now, many times when you tell the child, don't do this, don't touch that, normal children will understand that, but an autistic child will keep on doing that. This is what you'll observe in your clinic, remember. And therefore, one of my friends who has written a book on materia medica, he has written case taking before case taking. Because actually our case taking starts much before case taking. As soon as the patient enters, as soon as the child enters with the parents, whether the child is sitting in one place, whether the child is coming near you, whether he's approaching, whether he's averse to you looking at him, all these are very, very important symptoms, objective symptoms that are to be perceived by all of you. So keen observation, as Dr. Hahnemann has said, is very, very important. So these body language, eye contact, developing relationship, sharing emotions or interests, they have a problem in that. Remember that. There are restrictive and repetitive behaviors. You see in the diagram here, the child has those round things and looking at the wheels, looking at the round things. He has restricted interest. A normal child will play with one toy, go to another toy, go to another toy. But these children will stick to one toy for a long, long time. Many a times we can think of calcarea carp for these children who have restricted interest. They will not move. The mother would say, when I'm cooking, when I'm in the kitchen, I am least concerned because my child will be sitting in one place for 4 hours together. Just give him a toy and he'll play with the toy. This is restricted interest. Now, a mother of tarantula or a mother of tuberculinum or medorinum or nux vomica will not do that because she will be always stressed looking where the child is going. As a tarantula mother would say कि जब मेरे बच्चा कहीं कुछ मस्ती नहीं करता तो मुझे टेंशन होता है, because that is when he is causing a lot of problems. Because tarantula, when he's right in front of you, it is okay. But when he's hidden somewhere or when you cannot see him, that's where he's causing a lot of problems. So these small, small things, right from the mother, from the teacher, rarely from the father, can help us, remember. So rocking or hand flapping movements, insistent on routines. Now, I want to tell you about an adult autistic man, we can say, because he's 19 years, 20 years, and I'm treating him for some time now. He wants to go to the same McDonald's, which is around 20 kilometers from their home. He wants his old mother to drive the car 25 kilometers one way, 25 kilometers another way, but always wants to go in that McDonald's only, sit on a particular seat only, have that typical burger only, always sit on the particular chair only. This is the insistence, and the mother has been doing it since last how many years I don't know. Now, this is the insistence on routines, which is very, very important. They like their own chair, they like their own spoon, they like the same biscuit, they like the same glass. This is insistence on routines. Highly focused interest, unusual reactions to sensory inputs. That means even if a small pressure cooker, okay, it is, and suddenly the child will keep his hands on his ears. Even if a plane is going from the top, that sound also can irritate. At the same time, you can have child who's putting on drums and making loud noise. What is this? Is this autism? Yes, both are autism because there is a hypofunctioning and hyperfunctioning of all the senses. And from this, we can derive the rubrics of autism. Remember, so if you look at hypofunctioning, you will find out, which we'll go ahead and we'll see. Okay. Now, what are the cause of ASD or autism spectrum disorder? Let me tell you why it is known as spectrum, because it goes from left side to right side, and on the left side you have got conditions which are associated with Down syndrome or epilepsy or mental retardation, where the child is removing saliva, applying on the table, licking it, removing his stools with his hands, even eating the stools. This is the left side where there's a lot of regression. On the right side of the spectrum, you will see excellent and very, very intelligent autistic kids, what we call autism savant, who have got typically good mathematical skills, skillful languages, drawing, painting. They can do better than Picasso. Remember, what I could say, they could do better than Picasso or even M.F. Hussain. Remember, it's very, very important. And therefore, there is a rubric that I want all of you to understand, which I've used in my practice for so many years in these children, is precocity of children. And I have used remedies like carcinosin, medorinum, nux vomica rampantly in these children, and it has worked wonders. Now remember. So now first cause, remember, we all say that vaccines, they cause. Now remember, vaccines, you cannot call them the culprit until unless there has to be a genetic predisposition. We all had vaccines in our childhood, but we did not develop autism. Why certain children are developing autism? Yes, there has been change in the vaccine structure also. Nowadays, you've got mRNA, DNA vaccines all coming up post-COVID, thanks to COVID, who has not only given COVID to us, but also COVID vaccine. Both of them have caused a lot of problems to us, right? So in autism, what happens? First of all, we have to know what is gut microbiome. Now, everything today in today's world, in medical history, whatever is going on today is around the gut microbiome and the blood-brain barrier. Remember, these are two things that we have to understand, especially if we have to understand allergies, we have to understand cancers, we have to understand autoimmune disorders, and we have to understand autism. Remember, this is very, very important. Now, gut microbiome means we have some good bacteria and some bad bacteria in our intestine. These good bacteria always outnumber the bad bacteria, and there is always a balance going on. Remember, so this good bacteria, remember, whenever we have good food like probiotics, we eat yogurt, we eat salads, and we eat so many good things which we see on the internet, we see on Instagram. We are eating good things, but sometimes we are eating a lot of sugar also. We are drinking Coke also. We are going and having pizza, and we are having pasta. All these things are going to increase the bad bacteria. Remember that. So there is a constant balance. God maintains that balance. Now remember why, as a doctor, I'm saying God, because it is God. Remember, God has created the body in such a way that these bad bacteria, bad viruses, they don't cross the gut and don't go to the brain normally. But if we are continuously eating Chinese food, if we are allergic to gluten, casein, or we are allergic to certain substances, and we still keep colored items, colored fruits or fruities, and so many other things, this is going to damage the balance. Remember, even vaccines can cause the damage. So most important thing is, whenever anything that damages the gut microbiome or alters the gut microbiome will cause problems. Now look at this figure. What we are looking at is there are good bacteria called, firmicutes, actinobacteria. These are good bacteria. If you see this figure. On the other hand, there are bad bacteria, that proteobacteria, bacteroids. Now what happens in autism? There is something called dysbiosis. Due to various things that we eat, the forbidden things that we eat, which our grandfather and grandparents have always told us, the forbidden things like the pizzas, like the pastas. And I'm not saying once in a while, but nowadays kids are exposed to this every day. Everyday processed food, everyday meat, everyday Coke, everyday diet Coke, which is of course worse. So this dysbiosis leads to decrease in the good bacteria and increase in the bad bacteria. Okay, and these bad bacteria create toxic metabolite production like phenols, cresols, indols. They cause a lot of inflammatory cytokines, which ultimately cross the gut barrier and enter into the blood-brain barrier and cross the blood-brain barrier also. This is very important. Secondly, even too much use of electromagnetic fields. Remember, when we were young, we did not have too much of Wi-Fi, number one. We did not have too much of, phone charging. We did not have internet. We did not have gadgets. All these things are existed today. And now, do you understand why autism is more diagnosed today than 20 years back? Because 20 years, all these things were not there. Food was good. Water was good. There was no EMF, that is the electromagnetic field. But now everything is there. Okay. So vaccines and EMF, according to me, is the primary cause today. The blood-brain barrier dysfunction and inflammation of brain by vaccines and the electromagnetic field in the form of gadgets, Wi-Fi, easy access to mobile phone. Many a times we see that our children or anybody's children, when they sleep, before they sleep, they usually are either exposed to TV, they are exposed to Netflix, they are exposed to channels, or they are exposed to their mobile phone just before sleep. And the brain thinks that it is a day, remember. When there is a lot of light, the brain thinks that it is a day. And I have seen people not sleeping up to 2 o'clock, 3 o'clock and developing psychiatric problems, remember. So easy access to mobile phones, keeping the charger near the bed or pillow, keeping the phone with less charge. Now remember, when the charge is very, very less, 8, 10, 20, the electromagnetic waves are very, very high. Therefore, when the charge is less, you should keep the phone out of the room. Remember, it's very, very important. COVID vaccine has been instrumental, right? Alteration and dysfunction of gut microbiome or gut-brain axis. Rampant use of antibiotics. Now remember, we were children, we were never given too much antibiotics. We did not take antivirals. Antipyretics, yes. But use of animal proteins like meat and casein, we don't know where the milk is coming from. Whether the milk is pure, not pure, whether it is, pasteurized or not pasteurized, plant protein like gluten. These cause autoimmune reactions, use of stimulants like processed food, MSG, aspartame. These are the things that are going to alter the gut microbiome. Of course, one of my researches last time I presented in Spain was mothers' emotional health during pregnancy. I have seen at least 50 mothers in Turkey where I have a clinic, and I have a clinic and my practice of autism there started with Istanbul, Turkey. And that's where I saw that these mothers were tortured during pregnancy. The husbands were quite dominating, they were narcissistic, they suppressed their wives during pregnancy, they abused the wives during pregnancy. It could be physical abuse, sexual abuse, religious abuse, it could be psychological abuse, it could be financial abuse, but all kinds of abuse. And especially in the formative months of the child, around 3 months, 4 months, 5 months, this abuse led to autism. I have 50 cases which are documented that they were abused during pregnancy, they were alone during pregnancy, they felt lonely, they felt sad, they felt angry, all these emotions during the 4th, 5th, 6th month of pregnancy, and the child developing autism. So it could be a primary autism where the child was born with autism, or it could be a secondary autism where he developed autism 2 years or 3 years after he was born. Now remember, when we are talking of mother's history during pregnancy, it is important that we find out whether it is a primary autism or secondary autism. Because in secondary autism, the child is developing for 2 years normally, remember. Therefore, there could not be any cause in the pregnancy or in the womb. The cause has to be external when the child was born. When the child was not born in the womb of the mother, at that time when she was suppressed, abused, angry, sad, all these emotions could have led to autism. Remember, it's very, very important. So mother's emotional health during pregnancy, of course, fragile X chromosome, rubella, lack or excess oxygen. Now, lack of oxygen could be one of the factors, remember. Therefore, there are many people, many doctors who have also started, oxygen clinics and oxygen therapy for children, which gives, of course, I don't really agree with that because it is the predisposition. Remember, as homeopaths, we are taught that we should have a genetic predisposition, which is the fundamental bias. And then the exciting cause, which could be the vaccine or which could be the oxygen, which could be anything. But there has to be a genetic predisposition. We'll have to look at the fundamental mechanism. Therefore, finding the history of the mother, history of the father. Why only mother's history? Why not father's history? I have many cases where I have given the autistic kid a remedy based on father's history during pregnancy or during conceiving. Remedies like Staphysagra or where the father was continuously insulted and he came with that mentality home at that time the child was conceived. Now the mother was absolutely okay. There was no problem with the mother. But when I coincidentally or accidentally asked the father, tell me something about you. When the baby conceived, how was your nature? What was the problem? And he said, I was really stressed all the time during her pregnancy. And in fact, when she discovered that she was pregnant, just few days before, I was fired from my job. I was insulted in front of my peers and colleagues, and I left the job. I threw it away, and I just came home. That was the condition of the man when the baby was conceived. Therefore, let's not only look at the mother's history, let's look at the father's history also during pregnancy. Okay, so these are the causes. So therefore, genetic predisposition plus environmental toxin will lead to autism. So this is a very, very clear thing, and I have seen this many times in the practice. Remember. Now, when you look at the diagnosis of ASD, we look at behavioral issues. The bacha hyperactive hoga, she'll be hyperactive, lot of temper tantrums, poor attention span, decreased concentration, poor focusing. Of late, I have been also using a lot of batch flower remedies, remember. And they work wonders. They work really wonders. And sometimes I am tempted to give only batch flowers rather than homeopathy. Because many a times homeopathy is easier said than done. Remember, when we say that, okay, we are classical homeopaths, we are going to give constitutional remedy, kabhi even tuberculum and tarantula is difficult to differentiate. Remember that. And I find it really difficult to differentiate even between a tuberculum and tarantula. Because we know that tuberculum is not cunning, but it is given in the rubric cunning. Remember that. Okay, so it could be cunning, it could be deceitful, it could be adventurous. It's really very difficult. But when there is hyperactivity, there is a remedy called vervain. There is a remedy called impatience. When there is decreased concentration, there is a remedy called chestnut bud. When there is poor focusing, it is chestnut bud. When the child is in his own world, thinking in the infinity, think of clematis. Now, this clematis is not our clematis in the homeopathy. This clematis is a batch flower clematis. So using batch flowers along with homeopathy, it has really accentuated my practice 10 times as far as autism is concerned. So first thing is behavioral issue. Second is speech, language, communication. Third is social skills. That means when you're talking to the child, the mother is saying hello, he's not even looking at you and probably he'll be looking there. You've seen the movie My Name is Khan, where Shah Rukh Khan, when he's talking even to Rani Mukherjee, he's looking somewhere else. So there is a poor eye-to-eye contact, and this is the first thing. Mind well, my friends, with the first thing that our homeopathy will bring back to normal and bring a smile on the mother's face, on the father's face, on the grandfather's face, everybody will be happy. Over the years, I know autism is not an illness of the child. Autism is an illness of the family. You have to treat the family as a whole. Remember, the mother, the father, the sibling. Don't neglect the sibling, because the mother is going to take care more of the autistic kid. The other sibling, so-called normal sibling, is converted into an abnormal sibling. Abnormal psychology, because he is neglected. Though she does not neglect him directly, but there is an indirect neglect. And imagine the child is Ignatia. What will happen? He will not say, he will suppress, he will keep it inside. And if it is a girl, remember, with a lot of hypersensitivity, lot of problems, she will internalize all these problems, which is again related to her, and she'll develop PCOS, she'll develop infertility, she'll develop irregular periods. This is all how it will go. So take care when it is young, take care of the whole family. So when you're talking to an autistic kid or to a mother of an autistic kid, let the family be together. Bring the family together. Find out what are the problems in the family. Homeopath's duty is not only to give homeopathic remedy, but also counseling. And that's what Hahnemann said. Prevention is more important than cure. Don't forget that. Okay? When we study the symptomatology of autism, some children present with predominant features of behavior. Okay? So what you'll see is now this is a clear pattern that I have come across, that you find out that some children will have problems with behavior. When he comes, he'll start running here and there, restlessness, impulsiveness, breaking things. So this is a behavioral pattern or the kinetic pattern. Some children will come and sit, but little noise here and there, little too much of light, too much of noise, and they will go into, meltdowns, intense sensory disturbances like noise, touch, vibration. Remember our remedy borax. I remember my teacher, I attribute all my knowledge of autism to Dr. Praful Barwalia. of Spandan Foundation. He was my teacher in Organon at CMP Homeopathy College, and he has taught me everything what I know about autism. I have learned autism from him, and he told us, and imagine a remedy like borax, which he had given, which I thought borax is only for ulcers, right? Borax is for hair problem or leukorrhea or whatever. But then he gave borax in autism, where the child had fear of downward motion, which is we all know, and second thing is sensitivity to noise. On these two features, he gave borax, and the child miraculously came back. Now, this is very, very important. So, a remedy like borax, a remedy like lysine, a remedy like hura, we have given in autism. So, there is no this remedy or that remedy. There is no specific. So when people tell me that I always start with thuja because bad effects of vaccination. No, 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 no. You cannot start with thuja all the time. Yes, thuja is a good remedy, but you can't give thuja all the time. You can give hura. You can give lac cananum. You can give lac asanum. So many remedies are there. Milk remedies have proved excellent in autism. Remember, I have given many, many milk remedies. I have given remedies which are even going up to the level of reptiles, spiders, snakes in autism, depending on the mother's history also. Remember that. So there could be sensory disturbances, there could be kinetic disturbances. A third variety, as I told you, on the left side of the spectrum, regressive features. Involuntary urine, involuntary stool, eating filth, saliva coming out, licking, eating stools. This is very, very important. Accordingly, we can see distinct repertorial totality, repertorial syndrome, and distinct groups of collected symptoms as well as group of medicines. So this is the sensory pattern, hypo or hyperfunctioning. We have 7 senses, remember. Now in those 7 senses, we have got eyes. Now what do you mean by hypofunctioning and hyperfunctioning? You got ears. What do you mean by hypofunctioning and hyperfunctioning? Now there was a child who came to me with his mother, and when he came inside, he was looking at me, he was looking at them, quite a happy child, smiling child. What he was doing is came on my table and started banging. And the mother said, don't do that, don't do that, don't do that. But he would not hear. He just kept on banging the table. And I was looking at him. Why is this child doing that? When I know that, okay, hyperfunctioning of the ear would lead to closing of the ears, or the child cannot bear even the slightest sound. What is this child with hypofunctioning of the sensation of hearing? What was he doing? What was he doing was he was a smiling child. He was always playing child. He did not even wince when he had some pain here and there. I thought, what is this child doing? And he was making a lot of noise. I asked the mother that, does he do this always at home also? He said, yes, doctor, we are really tired that when he is at home, he'll just play his drums. He has to do some kind of noise. And then I thought of, is there any rubric with noise? And then I looked at the rubric, noise inclined to make noise. And there it was, a simple remedy like belladonna. And I gave this belladonna, and mind well, my friends, belladonna has been my the remedy in at least 75% cases of hyperactive autism, remember. Yes, tuberculum tarantula are there, but belladonna, give it and see it. It's like there was a advertisement long time back, of a bike where they said, fill it and forget it. Here you give the remedy and just forget it, and the child will become okay. So parents report that the child startles from sudden sound. This is a hallmark of autism. Now remember, but you will have to look at this rubrics. Now the remedies in this is borax, stramonium, asarum, theridion, carcinosin, nux vomica, opium, china, many remedies. What is carcinosin sensitive to? Sensitive to dirt. So there is a hyper functioning of the sense there. At the same time, sulfur could be hypo functioning of this sense where he doesn't want to take bath, wears the same clothes. Carcinosin children, I'll tell you, a very, very small child did not even bear even a small drop on his shirt or in the diaper, even passing a little bit of urine in the diaper, the child would start crying. On that aspect, we have taken fastidious and we had given carcinosin. So such small things. Nux vomica, hard to please. Remember, fastidious. There were only 2 remedies, arsenic and nux vomica and Kent's Patti remedica. Now there are many remedies, but the 2 prime remedies are arsenic and nux vomica. Don't forget, my friends. Theridion, again, sensitivity to noise. Asarum, sensitivity to noise. Stramonium, sensitive to dark, fear of dark. They have to have a little light. Remember, the mother will always tell you, मेरे बच्चे को कुछ ना कुछ छोटा एक light चाहिए तो ही सोएगा, नहीं तो नहीं सोएगा. Opium, again, noise inclined to make, just like belladonna. So belladonna, opium, noise inclined to make noise. Even veratrum, remember. right? Second pattern is kinetic motor. I told you a lot of hyperactivity, lot of impulsivity, along with destruction and violence or without. Group of remedies are tarantula, stramonium, tuberculinum, medonin, and naxomium. Now, many a times you will get a variety where the child is banging his head on the back, throwing himself on the ground, lot of temper tantrums, because temper tantrums is not the right word as far as autism verbiage is concerned. What is important is a meltdown. The word used in autism is a meltdown, and this meltdown, especially in moscus, especially in tarantula, is really, really bad. But what is the basic difference? The mother asks the mother that does he get injured when he throws himself? He says no. Every time he falls on the sofa or falls on the pillow or keeps his hand and bangs like this. This means that he is deceitful, he is cunning, he is manipulative. Think of tarantula here. Now tuberculosis will not do that. And the most important differential remedy is moscus. Moscus is in such a frenzy. Moscus is in such a hysteria that he's going to throw himself anywhere and cause injury or cut on his head also. Another basic remedy is lysinum. Lysine also is very, very important for self-destruction. Think of lysine, stramonium, tarantula, belladonna also, tuberculum also. Regressive, as I have told you, involuntary evacuation of stools, urine, associated Down syndrome, dull, passive state, lascivious, you can think of Helleborus, Hyoscyamus, Bufo, Banaitakam, etc. So these are the three patterns, remember. Now, agaricus is autism is a spectrum disorder. Some children show gravitational fear. They are scared of jumping from height, while some would love to climb on high places and jump. Can you understand? Even a small height, agaricus is scared of. At the same time, on a big height, agaricus will jump. Because agaricus is a mushroom, remember. When it is a mushroom, when you take the mushroom, if you read Borix materia, is given 4 stages of intoxication. In the second or the third stage, he does not understand the distance. He does not gauge the distance. So agaricus would jump from heights or run on the road without knowing the danger. And therefore, agaricus becomes my prime remedy. For hyperactive children, when the mother says, ये हाथ पकड़ता नहीं, हाथ पकड़ा तो छोड़ के भागने लगता है, क्रॉस करने को डरता नहीं है, कहीं से भी कार आ जाएगी, on the parapet of the 3rd floor or 4th floor, he'll be jumping and playing, no scared at all. Does not mean that he's adventurous. Don't give tuberculin. Tuberculin is adventurous. He knows the danger. Danger, no sense of danger. So he knows there is a danger, but he is taking risk. Adventurous. While agaricus has no fear, fearlessness, because he's not able to gauge the distance. So understand the difference between tuberculin and agaricus, because they come very, very close in hyperactive autism. Remember that. I talked about autism 7. One of our prime remedies is carcinosin. One of our prime remedies is medoran. They are 7 absolutely intelligent, precocious children, much more. I had a small girl who could read the whole Gita, which we have not still done, but they could read the whole Gita. I had a patient in Turkey who was able to know 5 languages at the age of 4. Remember, can you imagine a 4-year-old knowing 4 or 5 languages? That is the autistic 7. That is our carcinosin. And therefore, carcinosin again forms 80% of our 7th autism prescription. Case taking in autism is much different from Niharika. How much time we have? Or Shweta?
So you may take your time, it's okay.
No. That's no. You two have your presentation, right? So because this is like a whole day or 2 day seminar that I'm doing now, so it is very difficult. So I may not talk about some cases, but I'll quickly. So how many minutes? 10 minutes? 5 minutes? How much?
Yes, sir, you can take 10 minutes, 10 to 15 minutes. Yeah.
Okay, 15 minutes. Fine. So now case taking in autism is different from any other problem. Now keen observation is the key. Observe the child right from the time he or she enters the clinic. Find out the PQRS, 153 aphorism. Find out the characteristics. Educate the parents. Now remember, when the mother and the father come, they start, my child does not have eye contact. He doesn't obey commands. So what are these? These are words from the internet. These are the words from books of autism. They have learned all this and they know more autism than you. Remember, don't even think of talking about autism per se in front of a mother or father of an autistic kid, because they know it more than you. But what you need from them is the homeopathic part, the characteristic symptom, how your child is different from other kids. No eye contact, every autistic kid. But looking from the side of the eye, yes, that's it. Why does he look from the side of the eye? Because he may be cunning, he may be deceitful, he may be trying to threaten his mother. That's where tarantula can come. So, no eye contact, but seeing from the side of the eye could be an important symptom for you. But no eye contact is not a symptom for you. So, don't go into the repertory and say, "Oh, no eye contact. I found these remedies." No, don't do that. So, educate the parents about autism. Parents need to be educated about what is needed to treat the child. The characteristic PQRS symptoms. Look at the cravings. Look at the aversions. Look at the thirst. Look at the sleep position. Look at when the child is not active in sleep are the best symptoms. The moments that he makes. The moments when the child is not noticed or feels that he is not noticed. This is very important because children like tarantula can really take you for a ride. Remember, they can threaten you because one of the most important symptoms of tarantula, whether it is child or adult, is threatening to destroy. They'll do something that will threaten the whole environment. They'll cry so loudly that all the other parents around will say, "Oh, what a mother you are. What a father you are. Look at the child. Why don't you give him a chocolate? Why are you making him cry so much? Look at the tears." But this is all natak. This is all drama, which you should know, which you should tell parents. And the parents know it, but they fall prey, remember, to this natak and drama. Remember, information from mother and caretaker is very, very important. Point of regression is very, very important. Finding the remedy, death of someone, change of school, change of residence. Important remedy is walnut here. Remember, I want to tell you a very, very good remedy for cannot adjust to surroundings, cannot adjust to anything which is changed. If the child is not able to adjust, if the mother is not able to adjust, like menarche, menopause, puberty, pregnancy, these are states that which come suddenly, and then you're not able to adjust. Think of a remedy called walnut. Don't forget mother's history during pregnancy, but of course, primary autism and secondary autism. How to convert patient language into rubrics. Look at the pattern. Kinetic hai, sensory hai, कि regressive. Look for senses. Hypofunctioning hai, क्या hyperfunctioning. How does the child behave in the waiting room? What does he do after entering? All these are remedies, my friends, remedies. And at some time when I talk with Kavita or Shweta, we'll find out the remedies also. We'll talk of remedies also. We'll talk about cases also. What does he do after entering? What is his reaction? What do you offer toy or chocolates? Is he sitting still, restless? Is he obeying the parents? Reaction of the child to what parents are talking about him. Reaction when you talk to the parents. Physical characteristics, my friend. Don't forget cravings, aversion, sleep position, thermal modality. Okay? Exact situation at the time of regression. So this is hypofunctioning and hyperfunctioning, as I told you. Case taking, how you can do your case taking. Whether the eyes, some children are glued to the gadget while others are averse. Ears, some children close their ears, some children play drums. Smell, some autistic children smell everything, while some children will not smell anything. Some children like to be cuddled, caressed, kissed, touch sensation. Hypofunctioning. Hyperfunctioning, don't touch me, go away, I don't want to touch. And the child will cry if you touch him. Tasting, balance, vestibular, body position. Therefore, I said there are 7 senses. This vestibular is very, very important. Fear of heights or no fear of heights. There is a rubric called amusement averse to and amusement desire. Very, very important rubric for autism. Remember, we have lachesis, tuberculinum, pipermethysticum. In amusement desire for, and many a times the mother would say, इसको roller coaster में बैठने को बहुत अच्छा लगता है. उसको कहीं पे एक छोटी जगह पे जाने को अच्छा नहीं लगता, but he likes to go to amusement park. So amusement desire for, I give tuberculum to these children because they are daredevils, adventurous. They'll play wheelie. They want to drive cycle very fast. All these movies where the hero or the heroine is opening the window of the car, we have seen so many heroes, right? They remove their, and they want the air to come on their face, the wind to come on the face. These are tuberculums, remember. Strangely, all those who are doing this, the strange part is they died. Remember, we saw a movie where Irfan was doing this out of the car. We saw a movie with Sushant doing that, but somehow, so that is something which I have noticed or I have observed. I don't know whether it is true or no. So these are the rubrics. Remember, every sense, hypo or hyper, can be converted into a rubric. Whether it is touch sensation, there could be aversion, there could be desire. Noise, there could be aversion to noise or inclination to make noise. Some rubrics which are important, which I use in my practice: curious, precocity of children, contrary, रेस्टलेसनेस इन चिल्ड्रन, आस्क रेस्टलेसनेस का मतलब क्या है, जंपिंग है, क्लाइंबिंग है, रनिंग है, आस्क, qualify the symptom, don't take the symptom restlessness, find out what is restlessness in the kind. Love for animals, disgust for animals, nature loves, traveling desire for, wandering desire for, very very important. Cunning, all psychotic rubrics, psychotic miasm, cunning, deceitful, mischievous, hiding. So I have grouped these symptoms together. Destructive, what is destructive? Either throwing things, breaking things. What are they doing? Destructive माने क्या? मतलब क्या है? Destructive का. Biting, spitting, pulling hair. Belladonna is not always biting. Now we know belladonna is biting, but they are not. They are very very sweet, nice, smiling kids. Remember that. Belladonna, only when they are forced to do what they don't want to, then they will start biting, spitting, pulling hair. Otherwise, they are very, very sweet children, smiling children. Remember that. Noise inclined to, like to play music. That's what is belladonna, remember. So don't just look at the marks in this rubric. Biting children does not always mean belladonna. It could be anything else also, remember. Now, belladonna is also there. Opium is also there. Both are in noise inclined to make also, remember that. So remember, there are many similar rubrics and you have to play in between the rubrics, convert the language into rubrics. This is the homeopathy case taking, which of course, again, importance is regression. What is the time of regression? How is the performance in school? Work and play, reaction to scolding and insults, appetite, desire. I have seen lemon, ice cream, salt, ice, medorrhinum. Very, very important remedy. Only three things: better at sea, lying on the abdomen, craving for sour fruits, and the fourth most important thing is the mother would say, रात को सोता नहीं है, रात को उसकी एक्टिविटी बढ़ जाती है. Is very very hyperactive at night. They might be sleeping during day, but they are very 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 hyperactive during the night. On which I have given medorrhinum to these kids, worked wonders. Okay. This is the pattern that I have devised: sensory pattern, regressive pattern, self-injurious pattern, kinetic pattern. So this gives us a little bit understanding about autism, understanding of how to approach autism, case taking in autism, what are the patterns. Patterns does not mean sensory cannot go into kinetic. They all intermingle, remember. What is more important, it makes our task much more easier. It makes our task, the spectrum less narrow, so that we are able to find out the remedy. Okay. So next time probably we'll do some homeopathic remedies also. We'll do some cases also. So I think I have bored you enough. So thank you very much, and thank you KHA, thank you Kavita, Niharika. I'm sorry I took some of your time. So the thing is, it is a very passionate subject, and when I start talking, since I'm a teacher of materia medica also, I cannot stop teaching. So it's a double trouble, for me and for others. Thank you very much.
Thank you
If
so
you have
much,
any
sir, for
questions, maybe
such an
5 minutes
highlight.
to take some questions. If somebody has any questions, 5 minutes.
Yeah, sure. Please write down your queries in the chat box.
I'm happy that I sent this to many of our groups of fellowship in dermatology, the course which we conduct, and we have a lot of students from dermatology, cosmetology of Dr. Batra's academy. So thanks for coming, all of you. Would require your feedback about how the lecture was, so that I can improve better. I can do something more. Okay. Thank you very much.
Thank you so much, sir, for
Hello, sir.
such an insightful session. Yes, and
Hello.
yes, Dr. Sudha. Do you have any
Ma'am,
query? Yes.
yes, ma'am. Ma'am, if any toys regarding the autism children is considered special toys for those based on toys for
A little loud. I cannot hear. I cannot.
okay. Based on toys, sir, is any consideration point autism child?
What is the question, Shweta?
Can you please write down your query in the
Yeah, in
chat
the chat.
box?
Yeah, yeah.
Yes.
Okay, fine. I think, Shweta, you can take the questions and probably send it to me again and I will answer them. Because I'm
Sure,
in a
sir,
sort of
sure.
hurry, so I have to go for another.
Good evening, sir. Good evening,
Yeah,
sir.
yes.
Sir, the lecture was fantastic as always.
Thank you very much.
You were really
Okay,
good,
so
sir.
now the
I
question
liked
was
it.
based on liking for toys and things. Yes, I mean, I've seen, of course, it's very basic, and all of us know that pulsatillas and very mild people, they like usually dolls. I've seen tuberculums playing with a lot of cars and they like speed. That is very important. More than the car toy itself, they would rather drive a bicycle or uh, tell their father to drive the car fast. When the car stops at the signal, they'll start crying and howling. That is what I have seen. Rather than liking for toys, this is the live thing that we usually see with the children. Okay, so I'll take your leave. Thank you very much. And
Thank you
probably
so much, sir, for such an enlightening session on autism. And you rightly emphasized the critical importance of early intervention in achieving better outcomes. And your focus on keen observations, especially of body language, is truly invaluable in understanding such cases. And the way you presented and differentiated the remedies was exceptionally very clear and clinically relevant. Thank you as well for highlighting the key points to be considered during case taking, and it was truly informative and well delivered presentation. Thank you so much, sir. And
Bye-bye.
we would like to honor you with a car certificate.
Yeah.
Just
Hello.
yes, ma'am.
Yeah. Just wanted to convey Dr. Samir that the lecture was really fantastic. I suppose he knows that. Dr. Samir, he's
Yeah.
left. Yeah, I'm
Yeah.
Dr.
No,
Harjeet Samir.
Yeah.
Yeah, it was really good listening to you. And I would really love that if you do many more such sessions, please include us in your group. I would love to listen you
Thank
again.
you. Thank you. Actually,
Thank you,
this is a
sir.
2 day or a proper 1 day seminar. So the problem is wherever I go to speak, I get around 10 minutes, 8 minutes, 15 minutes. I was in Dubai and they gave 10 minutes for this. You were with us in Dubai and we saw that we got only 10 minutes. So it's very difficult to talk about such a topic in 10, 15 minutes. So it
So
requires
you
a
should
whole
keep
team.
a workshop, sir, on autism. We will join, sir.
Sure. Okay. I need to take your leave now. Okay.
sure,
Thank
sir.
you.
Thank you so much, sir. Thank you.
Okay. Wow.
Here's your
Thank you.
certificate. Please accept it from Homeopathy Study Group. And thank you for your gracious presence and for your precious time
Thank you.
in sharing your knowledge and wisdom. Thank you, sir.
Bye bye,
I'm
Shweta.
sorry to interrupt. Can I ask a small doubt before sir leaves? Just one small
You
query,
asked
sir.
something about game addiction and distraction from sound. So, Deepika, the
Yes.
thing is, there is nothing specific. That is what the thing is. There's nothing like for video game addiction or distraction. You'll have to look at the person as a whole. That is what we have been taught, right? So, there is
Yes.
nothing for video game addiction. Look at the child. It could be a tarantula, it could be a lachesis, it could be belladonna, it could be anything. So look at the child, not the addiction. As such, I deal also with addiction. So addiction is a big umbrella. Don't look at the addiction. Look at the person. Look at the child. That is the most.
So in the cases of autism also, we can consider these remedies, right?
You can consider the remedies anywhere, madam. Anywhere. It's not nothing is specific for autism. You can think in ADHD also. You can think in dyslexia also. You can think anywhere. The symptoms should match. That is very okay.
Sure. Thank you so much, sir.
Sure. Bye bye. Take care. God bless you all of you. Best
Thank
of
you,
luck,
sir.
Niharika. Bye bye. Bye bye,
Thank you,
Shweta.
sir. Thank you.
Bye, sir. Now, I welcome our second speaker, Dr. Niharika Sapra, international speaker, writer, researcher, advocate for holistic healing. Niharika Sapra is a budding homeopath from New Delhi, a certified nutritionist and childcare expert. As founder of Nipra Wellbeing, she advocates for holistic healing and has volunteered with Holistic Approach USA to promote global healthcare and homeopathy. Her professional experience include internships at charitable dispensaries, Lajpat Nagar, and roles as former campus ambassador with BGen Pharmaceuticals, former marketing executive at Doco 360, former writer at Think Wellness 360, educator and IT assistant at Gang Homeo, She has participated in over 100 plus webinars and seminars, earning accolades such as the National Appreciation Award at the 22nd All India Homeopathy Congress, STSH 2023 Award, CCRS Student Research Scholarship, Best Volunteer Award 2025 from CA, USA, Homeosena Award 2025, and many more. Having published her work on health and wellness at various platforms, her mission is to propagate homeopathic treatment and holistic wellness globally. Stage is all yours. Please proceed with your presentation, Niharika.
Thank you, ma'am. I'll just share my screen. Hope it's visible.
Yes, it is.
Thank you so much, ma'am, for the introduction. And I would like to give special thanks to Dr. Kavita ma'am and entire Ka Holistic Approach group, Ka family, for giving me this platform. As you may all know, my topic for today is understanding the pediatric sleep mental health continuum. Is the screen still being shown?
No,
One second.
it's not visible.
Share it again. I think it's fine now, ma'am.
Yes, it's visible now.
I got this chance to present this topic at the Kinderschaft conference in Delhi, India last year. And I got the opportunity to work with the Sleep Society of Brazil, Germany, and India, wherein we discussed about different sleep disorders and how they can impact the pediatric health. Now, why this topic is important? Because sleep disorders are recognized as major health problem impacting especially the children today. It is major public health crisis which remains hidden and overlooked and should be addressed. Coming on to certain facts is the pediatric age group, firstly, which is usually not clear to few of us, that it is considered between the age of birth to 18 years of age. As it is stated that it aligns with the UN Convention and WHO states this. So this discussion today will make in focus on children aged 10 to 18 years of age mainly, but it may apply to others as well, depending on the case, if the similarity is seen then. WHO states, and I quote, that suicide is the third leading cause of death among youth today. So this becomes a major topic for discussion. And when we see through different researches, it is proved that suicide can be linked with sleep disorders.
Sorry to interrupt. Dr. Niharika, your slides are not moving.
Okay,
Yeah. Can you please start slide share?
I'll share it again. Like this, are they moving? Let's see. Now,
Yeah, it's moving now.
It's fine now.
it's fine now. So yes, as we discussed, the pediatric age group, the hidden warning, and suicide being the third leading cause of death stated by WHO. So research shows that depressed subjects suffering from either hypersomnia or insomnia showed significantly higher scores on measuring of suicide. Even the children who have previously in history taken such steps of undergoing such suicidal thoughts or committing suicides and they were saved, it was found out that these were the children who used to suffer from hypersomnia or insomnia, and they were in a habit of having frequent nightmares. Results indicate that nightmares predicted elevated suicidal inclinations. So insomnia and nightmares can be directly linked to the increased risk of suicide in youth. What can be done is timely evidence based and low cost interventions. These suicides can be prevented. So that's why this topic becomes of prime importance today. The objective being addressing the global problem of circadian misalignment, its causes, its impact on mental health, depression, suicide in children, to synthesize global and Indian evidence linking pediatric depression, sleep disorders, and providing with clinical implications. Now, these clinical implications can be certain interventions, certain therapies, or it can be homeopathy. Coming to the sleep cycle, now we know there are 4 stages in which we can divide the sleep cycle. The first 3 being the non-rapid eye movement phase, where in the first one, we go into a light phase of sleep. There is a phase where you are just starting to fall asleep, your thoughts begin to drift, your mind slows down, and you go into a light phase of sleep, which is the second one. Your heart rate will slow down in the second phase, your body temperature will drop, your brain waves slow down, and you are asleep in this phase. And this phase run for nearly 50% of the time. The third stage being wherein you breathe, your breath becomes deeper, your cells start repairing yourself. So the N3 phase is a very important part of sleep, as most of the bodily repair takes place during this stage. And the fourth one is the rapid eye movement phase, the REM phase of sleep. This being the last stage wherein dreams take place and brain activity happens. There is this phase where the nightmares occur, and in depression in later slides we'll see that this phase becomes prolonged, it occurs early, and that's why this is very crucial that this phase should be regulated very well in children. Talking about the circadian rhythm, we are well aware that it's natural internal 24-hour clock, essential for sleep-wake cycle, for hormonal release, and for appetite. Now, this is regulated by the suprachiasmatic nucleus in the hypothalamus. Now, what this does is it controls the melatonin and the cortisol levels in the body. Cortisol levels are very important to remain awake the entire day to maintain that wakefulness. And during the night, it is important that the melatonin levels increase so that the sleep initiation happens. Now, this master clock of the supraclavicular nucleus, it receives light signals from the eyes and controls the body's internal timing, decreasing the secretion of melatonin and increasing it during the night. This way, the biological clock is maintained and the body is able to fall asleep and be awake during the day. Now, how this misaligned rhythm, if this cycle becomes disturbed, the sleep cycle becomes disturbed, or the circadian rhythm becomes disturbed, how it can affect mental health, or how if the child is suffering from depression or mental turmoil, how can that result in affecting the sleep cycle or the circadian misalignment. This could be understood through three hypotheses or discussions: the bidirectional relationship, neurobiological pathways, and psychosocial pathways. The first being research shows and prove that there is a bidirectional relationship between sleep problems and depression. So, if the child or the individual is having insomnia, delayed phase, poor sleep quality, he is tend to developing problems like anxiety, low mood, fatigue, and further with prolonged sleep problems, it may result into depression. Why so? Because if the child is falling asleep late in night, or he is not at all sleeping during the night, what he will do, he will overthink, he will be anxious throughout the night. The next morning while going to school, he will be in fatigue, he will be sleeping during the day, his overall work efficiency will decrease compared to other of its batchmates. So this will result in him developing some kind of inferiority, some kind of negative thoughts and emotions for his own self, further resulting into depressive symptoms, and the cycle continues. Also, this happens in the child who is already having depression, who is having certain mental turmoils, and because of those mental turmoils, he is not able to sleep. Low sleep, in turn, results in more low mood. So, this follows. Neurobiologically, when we see the biology of our body and when we look at the cell, so at cellular level, what has happened, we can understand to these four aspects of it, and these are very well proved in different researches, that neurotransmitter dysregulation happens in both depression and sleep, wherein there are three main neurotransmitters: serotonin, dopamine, norepinephrine. Now, what happens when the sleep is disturbed or when there is depression? These serotonin levels decrease. Now, these serotonins are the regulators of the REM sleep that we talked, the last phase of sleep, which initiates dreaming. That is early. The onset of it becomes early and increased density of REM happens. So there are prolonged dreaming period which affects the child's sleep and which prevents from sound sleep. If the sleep is disturbed, automatically other things will be affected. Similarly, the dopamine levels become decreased in depressed children, which results in fatigue and fragmented sleep. Then there is norepinephrine levels which become high, which results in hyperarousal and insomnia. These children are not able to fall asleep early. Effects happen that the REM sleep is early, there is sleep fragmentation, and there is hyperarousal, which is resulting in poor quality of sleep. Similarly, in circadian rhythm and melatonin relationship, when we talk about it, we have discussed that the cortisol level should be more in the day and less at night, and reverse happens in case of melatonin. But there is a natural phase delay in adolescence. So adolescents are already suffering from a social jet lag. They are set in a way, their biological clock, their circadian rhythm is set in a way that they fall asleep late during the stage of adolescence. Now, what depression does is it exaggerates this jet lag, it further prolongs it further. When we talk about depression, again, the melatonin levels will be decreased during the night, which will impact and give brain weaker signals, prolonging the REM phase and also poor sleep quality. So, this way, the overall sleep becomes disturbed, and again the viscous cycle follows. The third one being inflammatory pathways in depression and sleep. Now, inflammation is the body's defense response to infection, injury, or to stress. In depression and poor sleep, it fuels up the chronic low grade inflammation in the body and brain. So, what happens? Chemical messengers like IL-6, TNF alpha, CRP, all these becomes elevated, and their elevation further results in low production of serotonin. We have seen that serotonin production will be low, then the REM phase will be increased. It will result in low mood during the day, anxiety, and further piling up the sleep disturbance and sleep disorders. So everything is linked. These are just different factors which we can account for increasing those problems. The last one of this being the HPA axis hyperactivation, that is the hypothalamus, pituitary, and adrenal gland. Now, what happens in chronic stress or in depression? This HPA axis is hyperactivated, so it raises the cortisol levels. And if cortisol levels will be elevated during the night, what will it do? It will delay the phase of falling asleep. The melatonin will decrease, and there will be conditions like insomnia or other sleep problems the child will suffer from. So again, it is talking about the same thing. Now, what we can do? We can early diagnose the signs of sleep problems in children. We can know the causes and risk factors of it so that these are not missed. Talking about these psychosocial pathways which can result in it, the first one being stress and emotional regulation. Now, the child is suffering from academic pressure, peer problems, bullying, body image issues. We see children in dispensary where the child is so much thinking that I'm looking fat or I'm too thin, especially the girl, that the entire night they're not able to sleep because of this thought of the body image issues that she's facing in schools during the adolescence age, relationship problems or friendship problems that the child have started facing now. There is a fear of missing out and gender dysphoria, especially like in other countries. This thing is very prominent, that the LGBTQ, whether the child belongs to that community or not, the child is so confused, and at the same time, for its gender, it is facing such kind of bullying in school that he or she is not able to share with parents or with teachers, that he is continuously thinking about it during the night and is unable to sleep. So these are the factors which troubles a child, and nowadays these aspects have increased more with the use of social media. The next we talk about are behavioral factors, in which the screen time, the late night social media, the caffeine use, excessive gaming, maladaptive coping of staying up late at night, and then in result excessive napping during the day. So this forms a viscous cycle again for the child, and nowadays children are going early towards drug abuse, towards alcohol addiction, that has been preponed to adolescents and even to younger age groups. The third factor which influences is family and environment. So there are inconsistent parental routines. The parent is returning from work at 11 o'clock at night or 12 o'clock at night. So the child is up till that time. Though the child has to wake up early at 6 to, get ready for school. But because of the parental routine, his or her routine becomes disturbed. Then there are high stress household, family conflicts, and issues. There are high number of parental divorces that are happening nowadays, which affects the child's mental health, child's sleep cycle, and overall health. Poor parental mental health, especially maternal depression, is also a factor which can result into the child facing certain problems, both sleep-wise and mentally. Then lack of unconditional love or care can be another such factor. Now, what can we do? As I mentioned, early diagnosis of the warning signs, knowing why the child is feeling low, his behavior is changing, or asking the teachers if he's doing well or not. Regular parent-teacher interaction is essential. Ending the stigma, of mental health, ending the stigma of certain issues with the child faces early, not binding the child too much, rather understanding him, because during adolescence, the child needs his or her parents the most. We can quickly understand what in such cases the approach can be through two cases. These cases were taken under the guidance of Dr. Vijay Kumar, retired HOD surgery, and I'm always very grateful to sir for his teachings. It was recorded at the charitable Sant Nirankari Dispensary, Lajpat Nagar. So the first case is of a 17-year-old female. She was preparing for her NEET UG examination through a coaching center, and she was in the habit of studying late at night, keeping herself awake by dropping candle wax on her hand. And she used to hardly sleep for 3 to 4 hours. Matlab, the child is so much under pressure, be it academic pressure, peer pressure, parental dominance, and pressure, that she's waking herself up by that pain sensation she's getting on her finger after dropping that hot candle wax. So that is such stressful environment in her head that is going on. Now the symptoms which she was having certain restlessness, anxiety issues, especially before her class test. Entire night she was studying, but during the test she used to start vomit, she used to start having anxiety, she was not able to give those class tests. So the parents consulted us, and we easily diagnosed that she is not aware about the importance of sleep, she is not aware about balancing out her academic and her personal life. Now here what we did was parent and child counseling. Importance of sleep and sleep hygiene was explained to the parents and to the child. Cognitive behavior therapies were recommended. Mindful yoga therapy was advised. Now, in cognitive behavior therapy, the child was told the importance of sleep and how to regulate this sleep for the child, like fixing a proper time for it, only limiting bed for the purpose of sleep, and studying separately on a study table or otherwise. So such analysis were made. Mentally, her stress, there were certain activities which were done to reduce her stress mentally. So such things were done, and there was significant improvement with no further complaints reported from the child. And here, my friends, it is to be noted that this case was dealt without any medical interventions. We have not given her any medications. We have just given her behavioral therapies and yoga therapy, which worked for her. And also, parent counseling is very important, because sometimes the parent pressurizes the child so much for exams, for performing well, that the child is not even at fault. It is the parents who are at fault. So that also need to be dealt with very carefully. The second case was of a 16-year-old male who complained of having decreased appetite, weight loss, and the mother told that he was in a habit of waking up late night, usually falls asleep 3 a.m. There was overthinking the entire night that the child used to do, and he was in a habit of playing game the entire night, wakes up late in morning, low attendance in school, and daytime sleepiness. So overall misaligned circadian rhythm was reported. When we went deep into case taking, and we separately consulted the child regarding what all is going on in his life. We got to know that he's having disappointed love, he's having relationship issues, friendship issues at schools, and such things he is dealing with. Now, all these thoughts affect him so much that he indulges himself rather than overthinking to playing games so that his mental pressure or his level of stress and thoughts come down and decrease down. So we can easily say that the irregular sleep is affecting his quality of life, and it is making him emotionally more vulnerable. Here we have given one dose of Ignatia 200 followed by Saclac. Then counseling was also given in this case. Sleep hygiene, bedtime habits were explained, and within 15 days, 20 days, there was significant improvement. The child was emotionally more stable, was able to deal with situations better, and he was following the advice and counseling we gave him for bedtime hygiene. So there was significant improvement with no further complaints. So this way, there are different remedies. These are some of the remedies which different research studies all across the globe have shown to be useful, like arsenic album, oromid, belladonna, calcarea carp, calcarea falls, causticum, ignatia that we talked about. Then there is creosote, magcarp, and other such remedies. Now, in Nux, we see that the child wakes up at 5 to 4 a.m. and cannot return back to sleep. There is disturbed sleep. In Sepia, there is unrefreshing sleep, and other mental symptoms can be covered. Like in case of lachesis, there is jealousy, suspicion, loquacity, depression worse on waking that the child faces. In sulfur, there is sleeplessness between 2 to 5 a.m., restless, vivid dream that the child has. Zinc there is frigidity, there is marked restlessness. In spite of these remedies, these are the ones which the researcher shows. Other remedies which clinically can be used, like tuberculinum, tarantula, and the list may go on, medorinum, and other certain remedies which correspond to the child's symptoms, as we say, the constitutional remedy or the most apt remedy, depending on the child presenting complaints, the symptom totality of the child. So this can be taken only as a reference. The prescription should be done only based on the symptom totality. Tell the child, make them aware to get help and take action. Parent awareness is very important. What are the certain interventions? Introducing cognitive behavior therapies for insomnia, depression, especially in adolescents, counseling and supportive therapies, mindfulness based therapies, yoga, meditation, sleep, hygiene, education. In schools, when girls are being taught about menstruation and there are workshops regarding it, there should be workshops regarding sleep hygiene, sleep oriented diseases, and mental health issues in schools for parents, for teachers, and for students. Structured daily routine and their importance should be explained by teachers, because they are the primary source from which the child can get information from to the students, right? Then physical activity, there are dietary factors of a child which should be regulated by the parents and teachers. Then, as we talked, that parent training and family therapy can be a necessary intervention. Teacher awareness, school mental health programs to be encouraged in each and every school and to be made a compulsory part of the curriculum so that these problems don't get ignored. More awareness and research is required. These are certain dietary products which different researchers show to be useful in cases of pediatric sleep disorders and depression. Omega-3 fatty acid rich products like salmon fish, walnuts, flax seeds. There are other Mediterranean diet foods like leafy vegetables, tomatoes, then certain micronutrient foods like rich in vitamin D or magnesium or iron, zinc. These can also help in making the overall internal hormones to get better, those the secretions better and the levels of different enzymes better. So it will help the child deal with his or her mood, deal with depression, and fall asleep quicker. So this is a self-explanatory. Last but not the least, the emerging priorities in pediatric sleep and mental health. As I mentioned, there should be structured sleep psychoeducation for adolescents, education for adolescents on sleep hygiene, on how important sleep is for them, for circadian rhythm and emotional well-being. There should be sleep education programs for parents, educators, students. There should be regular monitoring at schools for screening and early identification for sleep disorders and depression in youth. And certain policies should be made globally and by the Indian government to address these problems related to sleep and mental health. For references, you may all scan this QR code or contact me at the given details. I hope this was an enlightening session for you, and I would ask for your forgiveness if anything was missed out or any error occurred. So, thank you so much for being such lovely, patient audience. Over to
Thank
you,
you,
Dr.
Niharika.
Shweta.
Thank you. And it was really a very informative, balanced, well structured, and clinically enriching presentation. Your explanation of various causes and underlying factors was extremely informative and helped build a clear understanding of the subject. So it was really wonderful.
Thank
Congratulations.
you.
And I'm just sharing your certificate. Congratulations.
Thank you, ma'am.
Please accept it from Ka Homeopathy Study Group, and thank you for your gracious presence
Thank you so
and
much,
for your
ma'am.
precious time for sharing your knowledge and wisdom. So, thanks to our honorable speakers and heartfelt thanks to our viewers and followers to join us today. Dr. Deepika, do we have any information for the viewers?
Yes, ma'am. I'm just sharing the screen. 1 second, please. So, good evening once again. Tomorrow we have a very important event wherein you can embark on a transformative journey with PSSM Global's complimentary 5 weeks of meditation and Sri Krishnamurtham sessions exploring the ancient wisdom of Anapanasati Swashamedha Dhyan in Telugu. You can also discover the power of mindful breathing to awaken your inner calm, clarity, and balance. I'll be sharing the YouTube Live link in the chat as well so that you all can join. Also, recently we also had a meditation and celebrated the Women's Day with an inspirational talk. I'll share that as well with you. Our topic on that day was the yoga of selfless action. You may also go and check out the recordings for the same. Thank you so much.
Thank you, Dr. Deepika. So we have many such informative webinars lined up in the upcoming sessions with many more renowned homeopaths. And for the upcoming webinars info or any other updates, follow our social media handles, Instagram, Twitter, LinkedIn, Facebook. If you missed any of the webinar, you can watch it out at our YouTube channel with the name Kavita Kukunur. And I'm very thankful to Ka volunteers for their continuous support and selfless services with which we are able to organize these webinars in successful manner. For any other info, reach us at kastudygroup@gmail.com and don't forget to fill the jot form in the chat box to receive your participation certificate. So thank you so much everyone for joining us today. Goodbye.